Welcome back. I know we had a long weekend in the sense of our presentations, and we have some great presentations coming up this week, beginning today with Dr. Zeitzer, who is a dear friend of Izzy Lifshitz and Pinky Lifshitz. So thank you for connecting us in regards to this presentation. And I know that today's subject as well is something that many of us, as we age, it's very important to make sure that you do have a good understanding of what you need to know to make sure your health remains with the aspects of ear, nose, and throat. Primarily today, we'll be talking about hearing, general ENT problems, and hearing aids. Dr. Zeitzer is a local doctor who actually I was searching because I asked him for a little bio, but I didn't follow up on that. But this is what I found. So if it's wrong, you'll tell me.
Sure.
I found that he went to the Lewis Katz School of Medicine at Temple University, graduated in 1966. Is that correct?
That's correct.
Oh, great. And has been working in Arizona for many years. And currently, I think that his primary focus is really as a consultant for the ear, nose, and throat issues, as well as in independent medical evaluations and industrial and forensic hearing loss analysis. So he maintains his time still in this field specifically and trying to help others in not necessarily in the practice field, but through making sure people are still taking care of their ears and everything that's involved with hearing and hearing loss. So I'm going to spotlight Dr. Zeitzer. Thank you very much for today. We're looking forward to learning about this. And again, if people who are on here, if you do have a question, Dr. Zeitzer, without giving medical advice, I'll use that disclaimer, will try to answer to the best of his ability all of your questions. So thank you.
Sure. I thought that this would be mostly a question and answer type of situation because I think that people learn more by that. Just to give you a little bit more information, as a rabbi stated, I did go to Temple University for undergraduate and also Temple University Medical School. I took my residency in otolaryngology at the University of Washington in Seattle. Otolaryngology means ear, nose, a study of ear and nose. They forgot the nose part, but some people call it otorhinolaryngology, but that makes it more difficult to spell. So ear, nose, and throat would be fine. I started practice in Phoenix in 1971. I was in active practice to about the year 2000. After that, I limited my practice to consultation and into industrial hearing loss. And that is evaluating patients for hearing loss that may be due to industrial noise, as well as other subjects in ear, nose, and throat. To give you a rough idea, ear, nose, and throat is the study of, the ear, nose, and throat and head and neck. Ear, nose, and throat specialty is a surgical subspecialty, and actually surgery is a significant part of the specialty. There are some physicians that practice only medical parts of ear, nose, and throat, but most physicians or ear, nose, and throat physicians do pick a portion of ear, nose, and throat to specialize in. Ear, nose, and throat, or the specialty of ear, nose, and throat includes surgery and medical aspects of diseases of the ear. And of course, hearing loss is a function of that as well. It also includes surgery and diseases of the nose, which include sinuses. Some ear, nose, and throat physicians uh, tend to specialize in cosmetic parts of ear, nose, and throat. And so that the cosmetic surgery of the nose is a significant part of their practice. You may see some ear, nose, and throat physicians that specialize only in that. Some ear, nose, and throat doctors also do facelifts and other types of cosmetic surgery. Um, Many otolaryngologists also do sinus surgery, which includes um, growth. Well, I guess you could state it as a gross surgery of the sinuses, and I don't mean um, gross in the sense that it's bad, but and also endoscopic type of surgery. So when I say gross, it's in uh, to distinguish it from endoscopic type of surgery. Some of the surgeries of the sinuses can be done without really making incisions and so forth, at least outside of the sinuses themselves. Um, of course, one of the things that ear, nose, and throat specialists are known to do is tonsil surgery, and many ear, nose, and throat physicians uh, specialize in pediatric type of ear, nose, and throat. And most ear, nose, and throat surgeons do surgery and other aspects related to that. Um, some also do surgery for sleep apnea, which is similar in many respects to surgery on the tonsils and so forth. Um, some ear, nose, and throat physicians also specialize in the larynx and voice, and this is a significant specialty in its own. This includes endoscopic and microscopic type of surgery. It may also include gross, if you will, surgery of the larynx, including cancer type of surgery. Um, we call ourselves head and neck surgeries surgeons as well, so that we also include surgery on the neck. Some specialize in thyroid surgery, parathyroid surgery, and also cancer of the head and neck. So that the specialty can be quite inclusive of many aspects of the head and neck. And we find that the usual otolaryngologists graduating from medical school tend to specialize in one phase of ear, nose, and throat. Excuse me. One of the um, common things that you might find a ear, nose, and throat physician doing is prescribing hearing aids. And I'm sure that this is a major question that the audience might have as far as aspects of hearing and use of hearing aids. Um,
Do you want to go right into questions now?
yes, so I
So,
will open the session up to questions.
so before you do that, I want to give you a little tech advice. So on your screen, I know I made it that you are full screen right now.
Uh-huh.
If you go, are you using a computer?
Yes,
Okay, so if you go to the top right of your screen where it says view, you can change
yes,
it to gallery view. It's going to be helpful for the question part.
okay.
You'll
Here we
see
go.
everyone's screens. Okay, perfect. So before we begin, I know with the microphone part where people ask, I see a question already in the chat. This is someone who would like to learn a little bit more about balloon sinuplasty, if you're able to share a little bit about that procedure.
Sure. That's a relatively new procedure. I had mentioned that sinus surgery is a common, commonly performed surgery in my specialty, and the use of endoscopes or telescopes that tend not to produce a lot of trauma in getting into the areas of the surgery are often used. Well, one of the newer techniques is actually to use a balloon type of insert that can be inserted through the openings into the sinuses. And these can be used to actually dilate the entrances into the sinuses and therefore eliminate a great portion of the surgery that used to have to be done. Also, this is something that can be done as a office type of procedure, again, eliminating a significant time and cost to treatment.
Before we open up, I see another question in the chat. Before we go even into, I'm going to ask a question that's, I guess, relevant of the times. Sure. What part of the ENT functions of our body do COVID affect?
Mostly smell.
Because I hear a lot of people complain about sinus pressure.
I think that actually loss of smell is one of the primary symptoms that go along with COVID. I'm not quite sure about actually affecting the sinuses itself. The virus is thought to actually enter through the nose and into the upper part where there are nerve fibers that control smell that go from the nose into the brain, and that this is supposed to be at least one of the mechanisms that the virus uses to enter into the body. And in doing this, it produces a loss of smell. And I've seen some individuals who have that are 6 months post having COVID and still have problems with smell. It is still thought to be mostly temporary, but I would imagine that there'll be some patients that will have permanent smell problems.
Wow. And there isn't some sort of a solution to that. It's literally the body has to figure it out.
That's correct. Yes.
Wow. Okay. Question from the chat here. Are there any new procedures for acoustic neuromas?
Well, it depends upon how new. Acoustic neuroma actually was one of the first surgeries that used a microscope in order to remove the tumor. After the otolaryngologists used that technique, the neurosurgeons caught on to the technique of using a microscope. And now the use of a microscope to remove tumors and to do vascular intracranial type of surgery is very common with neurosurgeons. So that this is a older technique actually, but is still utilized. One of the newer techniques is to use a gamma knife which uses gamma radiation to remove or to eliminate the tumor itself. Um, and this is gaining more popularity in time. There's still there are some side effects connected with that technique, even though it does not require actual surgery. And most likely, I would say that the use of microsurgery or surgery through the microscope to actually remove the tumor surgically is probably still more common.
So she followed up with she said that if she was told that if she does it, she will totally lose her hearing in that ear.
Remove or do what?
That procedure of acoustic neuroma.
And well, um, it depends upon the size of the tumor. But I think in most cases that is the case, whether gamma knife radiation is used or actual surgery, microsurgery to remove the tumor. There are some cases where a tumor can be removed without causing complete hearing loss. Um, there's also cochlear implants that can be that might help in that situation as well. I think it's also very important to determine how big the acoustic neuroma is, because in many cases, you are able to watch and follow it so that if the growth of the tumor itself is not fairly rapid, one can just wait and surgery may not be really necessary. So again, it depends upon the size of the tumor and any symptoms that it may be causing. But as far as loss of hearing, if it requires surgery, there's a good chance that complete hearing loss will be a result. I'm sorry, complete hearing loss in that ear will be the result.
Thank you. Another question in the chat. What information would you need to help someone regarding chronic polyps?
Well, it depends upon what classification that might be, because there are some problems that have a with chronic polyps that require recurrent surgery, and there's others now that we can use medications such as steroids or prednisone that decrease the need for surgery, and in some cases may be curative, or a combination of both surgery and then the use of steroids. So it depends upon whether the origin of the polyps are due to infection, due to fungus, or due to an allergic diathesis.
Thank you. And I have a question that was mentioned privately to me. So you had mentioned that part of the hearing aid process is typically that you get a prescription. I've noticed, this is what the question is, that they've noticed that there are plenty of opportunities now to buy hearing aids without a prescription. What's your thoughts on that? And does that mean you're not getting in other words, if you get it medically, is that going to be a better quality of a hearing aid or not necessarily anymore?
Well, it'll be more expensive.
If it's if it's
Yeah. That's a very difficult question because personally, I think that hearing aids are very overpriced, and that even though the more expensive hearing aids may result in a better fitting and a better result, the result or the difference between using a common hearing aid or a cheaper hearing aid may produce a result that is almost as good as the more expensive ones. So that there is an advantage to having a hearing aid fitted, or to have somebody that can be present as a consultant to um, help a person with the care that may be needed after the hearing aid fitting. At the same time, it may be worthwhile for someone to try some of the ready-made or available hearing aids to see how much help that may be, and be able to compare it to maybe one that is fitted and more expensive. I think it's important to try a hearing aid for a period of time before one decides to buy it.
Rabbi,
Well,
I,
one second, Arlene. One second. So, so on that note, as a follow-up to this question, obviously hearing aids can further damage your hearing because you're straining more to listen, if I understand correctly. I shouldn't say obvious, there's nothing obvious. But in that question, this is the follow-up that was asked to me. Can the cheaper hearing aids damage your hearing more?
No, and I don't know where that came from as far as that the hearing aids can cause damage to hearing. I don't think that that's particularly the case unless it's abused. I
Okay.
mean, you can always put a hearing aid on very, very loud so that it causes additional damage. But it usually doesn't work that way. And no, I don't think that a hearing aid, whether it is bought at Costco um, or over over TV or whatever, would actually cause any harm to hearing. It may not be as effective as another hearing aid.
Rabbi,
Um,
I had them fitted at Costco. I spent half of what I would have had from a private party. I have a wonderful guy there. I went without a prescription. I had had a hearing test before. And if somebody's asking about Costco, I have a terrific guy there who knows just what he's doing. Somebody's coming tomorrow. I'm taking her to finish her appointments. They've been fabulous. And mine are rechargeable. I never have to put a battery in. It's the most wonderful thing. When I'm in India, I just plug it in. That's it.
right.
It's,
Well, I think that they do a good job.
they
And
do fabulous
actually,
work.
a Consumer Report gives them I think the top of the line. But again, it depends upon the person who does the fitting and so forth. But
The
the
fitting-
point is that in many cases, the cheaper hearing aids are just as good as the more expensive hearing aids.
So as a doctor, when you were prescribing or telling people to get it, was it based off insurance? Is that how you determined if they should go with like if their insurance covered it or not type of a?
Well, there's no real prescription. I guess that really may not have been the proper word. I think that they should have a evaluation by an ear, nose, and throat physician to determine if there is something that may require or could benefit from treatment. But in the large majority of cases, that may not be the situation. And by prescription, I meant to recommend that a
Okay.
person have a hearing aid. The testing and so forth that may go along with the fitting is a different story. The physician usually does not control that aspect of things.
Okay, thank you. A question from the chat, and please do tell me if this is too personal and if you would take the question later privately. I'm going to read it. I was born with otosclerosis and had my first, I'm sorry if I'm reading these words wrong, stepedectomy in kindergarten and first grade. I wear powerful hearing aids. Problem is I have a constant ear infection that has been treated continuously with antibiotics. I cannot wear one hearing aid because it makes infection rapidly worse. I become functionally deaf consequently. I need better ideas. My ENT surgeon retired and his replacement does no surgery. options, question mark, hearing aids or infection, death.
Well, I don't know the details of that. Stapedectomy should not result in infection. Or it may have actually been before the era of stapedectomy where they did another type of surgery. And there is some problems with the potential of infection connected with that surgery. So I don't know exactly what was done. Infection under any circumstance is something that should be controlled first. I don't know whether this is maybe some infection due to irritation from the hearing aid or actual infection in the ear itself. So I really can't knowledgeably answer that.
Now,
Actually.
is that something later we can connect you and maybe through email?
Well, it would require, an examination type of situation.
Oh, okay. All right. I'll talk to you later and we'll see if there's something
Sure.
that you can suggest to her to who to go to.
Right.
Okay, thank you. I'm going to open up on the mic side. If anyone does have a question, please don't be shy. No one is judging you. I know that Betty and Stan, if you have any questions, since you are the newest people with hearing aids on the, that's what they were very proud of this last week. So they were actually excited to listen to what you share because they
Right.
can hear better now. Yeah, what do you want to say?
Yeah, we just got hearing aids about a month ago, and we got expensive ones. And the guy we went to said we were an unusual case. And the unusual case was most people go to somebody else and get burned and then end up coming to him. I mean, our exam with him was probably just the exam, the audio. He insisted that we go to an ear, nose, and throat specialist to make sure there was nothing wrong with our ears other than the fact that we had hearing loss, that there was no infection or anything else before we had to get an okay. And then we had an exam testing, was probably about an hour and a half each. And then the fittings, just to get the right size speaker in my ear, took a long time because I had a small ear canal and he tried some larger ones and I was very uncomfortable. So in some cases, getting a standard one probably wouldn't have worked for me. I don't know. I mean,
Yeah.
But you're saying
No, I don't know either. I can't really tell. I think that
not long distance anyway.
I think the
Like
previous,
that, but I don't think you're to see much.
I think the previous question was whether, essentially, whether the cheaper hearing aids were worthwhile trying first.
Yeah.
And the answer to that would be, in many cases, that's a situation.
Yeah.
Everybody's different.
That's correct. And if you're happy with your hearing aid, it's certainly well worth it.
Yeah.
all right, here's a question from the
It's
chat.
not one size fits all.
All right,
Yeah,
thank you.
exactly.
Here's a question from the chat. Is there any way to improve on hearing clarity when volume is not the problem, but understanding is the problem?
Well, one thing that many people forget when they have a hearing loss is that there is some damage, some problem within the inner ear itself. So it's not simply a question of, is the sound loud enough to hear? It is also that the inner ear and actually brain connections itself may be responsible for mixing things up some, so that speech, even though it can be adequately heard, is still not clear. And we call that discrimination or understanding of speech. And that's probably the reason that we have expensive hearing aids and adjustments and so forth. Because simply amplifying things does not help things completely. But no matter how expensive the hearing aid is, there usually still is a problem with understanding. The ear still doesn't hear like it heard 30 or 40 years ago. So that is essentially the dilemma. The answer would be that yes, things can be done to improve the understanding of speech. Not always, however, and in many cases, the less expensive hearing aids may be as good as the more expensive ones in that particular situation.
I will tell you one thing that the audiologist said to my husband Stan is he wants him to read out loud for 15 minutes every day.
And then he readjusted them. And he's going to readjust them again. But he would test me on things like cool, pool, tool, and school. And if I could differentiate with ambient noise in the background.
So Dr. Zeitzer, that was, first of all, I appreciate it. There was a lot of clarity to explaining what this question was and what people can expect if they start to need a hearing aid and why. And you mentioned there is something she can do. So are you suggesting she go back to her doctor for this, or is there a specialist that she should be speaking to?
Well, the question is, where did she get her hearing aid? I would go back to the person that she bought her hearing aid from and see if something can be done as far as adjustment. But there has to also be an understanding that there may not be a solution to her problem, and it may not be due to a hearing aid, and it may not be that a more expensive hearing aid or one that allows more adjustments would help things enough to be worth the difference in price.
Thank you. So Judy, you're muted. If you did want to follow up with that, you can unmute quickly. There you go.
It's for my husband, not for me. But he's tried all kinds of things. And so I was just wondering what kind of other things there might be for him to try. He has had different hearing aids, but it's always, the volume is okay. It's that he can't understand words. And I know I'll try that. I'll have him try that reading out loud and see.
There may not be a solution because the problem may be within the inner ear itself, that you can with a hearing aid, you can increase the sound or you can adjust different frequencies and things like that. But that does not necessarily help what is going on in the inner ear itself. So that it may not be any real good solution as far as the hearing aid. What might be helpful is to understand that much of speech and communication depends upon visual clues, depends upon watching other people as they are talking and watching other people to look at facial expressions and so forth. This helps even if your hearing is normal, because if you do have normal hearing, or if you remember when you did have normal, relatively normal hearing, when you were in a crowd, you still had problems understanding, even though your hearing was normal. And that is because, one, there is competing noise so that you don't hear clearly. It's not one person talking. And also, there's a lot of things going on. There may be a lot of people talking at the same time, and it's not that necessarily that you can't hear that person, but your attention is not on that person. So that you need to be able to look at that individual that's talking, as well as being able to hear what is being said.
Because competing noise is a terrible problem.
Right. Well, it's a terrible problem with normal hearing people as well. And of course, becomes worse when there's a hearing problem.
Well, many of the restaurants and public places nowadays have all hard surfaces, and there's music going on, and conversation is almost impossible.
I agree.
So
I
it's
agree.
not hearing, it's the ambient, it's the background. We don't
Right.
have carpeting and drapes and other things. It's easier for them to clean, and the noise just kind of echoes. Same with our TVs now. The larger TVs have smaller speakers. Now they tell you, send you now you have to buy a sound bar to hear better.
Well, also captions are very common. There's nothing wrong with using those.
We do.
Yeah, I mean, that's fine. My hearing is not that bad. I use captions because in many situations it's difficult. Well, it's much easier to be able to read than to clearly hear.
Especially with a foreign film or an English film.
Exactly.
So a question back to Judy's point, when does a cochlear implant sort of be the option to help someone for hearing?
As time goes on, the use of cochlear implants have become more common and more sophisticated and helpful. However, they still have problems, and there's nothing worse than having problems hearing and having it made worse by a cochlear implant. And even though that doesn't happen that often, it's still enough of a problem that one should think a lot before they go through that type of surgery. The surgery itself is not difficult. It's it's just that you're putting a artificial object in the inner ear itself, and that itself can be responsible for damage. In my opinion, I would not recommend a cochlear implant unless there were no other option.
That makes sense. Okay, so here's another question in the chat. What medications are used to help with dysphagia? I'm sorry if I pronounced that incorrectly. And how does Botox help or not?
That's a specific type of question that I really can't answer unless I have more information. But there are actually Botox can be used to treat certain types of dysphagia, where there is a spasm of the muscles of the esophagus, the beginning of the muscles, beginning of the esophagus, I should say. And this can be helpful in that type of situation. But in general, dysphagia can be due to many different things, and we really need to know exactly what the problem is.
Okay, next chat question. Can you explain tinnitus, and is there a cure for it?
Yeah. I guess the best definition I think I've heard of that is it's sort of like phantom sound. So in other words, it's a sound that isn't there, that is produced by the inner ear and perhaps by the central connections. It's interesting that if you take a individual that has completely normal hearing and you put them in a soundproof room where they listen very closely, they'll hear tinnitus. So that essentially everybody has a certain percentage of tinnitus. And as you develop hearing loss, usually the tinnitus becomes worse. Tinnitus is more common in people that have been exposed to noise and have noise-induced hearing loss from industry or from other aspects. But you can develop, or it's common to develop tinnitus in people that have hearing loss due to aging. And everybody, if they live long enough, will develop tinnitus and develop hearing loss as well.
Going back to that dysphagia question, if it's due to early onset Parkinson, would that change your answer to anything?
I can't answer that. I'm not that familiar with
All
that.
right, I just
Yeah.
following up from the chat.
Right. However, if that is something that was offered by a otolaryngologist who has, is doing active treatment for something like that, I think that sounds like it probably would be helpful.
Thank you. Any questions from the microphones while I monitor the chat ones? Go for it, Herb.
Yeah, how long should a hearing aids last, or how often should you be checked to see if they're working properly?
Well, they recommend that if you have a hearing problem, a hearing loss, you should have yearly hearing tests. As far as wear and tear for a hearing aid, usually 5 years is used, so that we would expect that a person would need a new hearing aid every 5 years. Hearing as you get older, of course, does change, and perhaps readjustment on that yearly basis may be a good idea. I think that one of the problems that the patients have with hearing aid fittings is that someone prescribes or recommends a new hearing aid very frequently. And I don't think that that is really helpful to the patient. Adjustments, perhaps, but constant getting new hearing aids is not in the best interest.
Thank you.
Thank you. Any other questions from the microphones?
I just wanted to mention something. We have a hookup to our TV with our hearing aids so that I can actually turn it on, keep it at very low volume on the TV, next enough, and walk into the other room and still be listening to the TV.
Right.
Meeting for me.
That is excellent, as a matter of fact. And there's several different types of apparatuses that can be used on that basis. There is a infrared type of transmitter for that purpose. And actually that does have a significant advantage because the sound is transmitted directly into the hearing aid or to the apparatus that picks up the infrared signal, so that it avoids distortion that might occur because of the room that the TV is in and so forth. So that that can be very helpful. The other thing is for people that have a hearing loss is many times they forget you do have a volume control on the TV. And sometimes, increasing the volume, particularly if they, live alone or both individuals have a hearing loss and, you're not annoying somebody else, but raising the volume on the TV sometimes works miracles. You don't need a hearing aid.
It's interesting with these hearing aids. We hear newscasters who speak very fast. We got it. Foreign accents, we got it. And it's really remarkable. But the fitting was very important. When he fitted me first, it was too much. I could hear everything, and it was just like, you turn on the faucet, it was like Niagara Falls. And he had to he had to readjust it, and now it's fine. But it's interesting because my husband collects clocks, and I never realized how loud the ticking was. Wow.
Yeah. Well, also some of the newer hearing aids, and I should say not necessarily more expensive hearing aids, but newer ones have ways of adjusting the hearing aid by using a watch, similar to using an iPhone watch. You can actually adjust the volume. You can adjust the hearing aid for different types of situations. For example, if you're in a crowd or whatever, or you can even adjust to different frequencies and so forth. And I think that will be something that will be helpful. They have similar things like that on some of the cheaper hearing aids. So it's not necessarily a function of, the cost, but it's something that actually the individual themselves can adjust. The volume, they can adjust the frequencies, and actually cut off some of the frequencies, because having a full range of the frequencies sometimes can be detrimental in certain situations. So that this in the future might be something to look forward to and be very helpful.
It's a lot of good information. Any other questions? I don't want, if you do have a question, we do want to give you that opportunity. We also want to make sure.
Not for hearing, but chronic cough. What is your suggestion for chronic cough?
Well, it depends upon what you mean by chronic. There are some individuals, that have significant cough where they can't really even sleep at night or sleep adequately at night because of the cough. And there's other people that, call it a chronic cough that, may cough every 15, 20 minutes or so. So it depends. Some of the problems with chronic cough may be related to ear, nose, and throat. For example, reflux or acid coming up from the stomach and irritating the larynx may be a cause of that. But there are other causes that have to be investigated. So it's a very broad subject.
Thank you. Izzy says have a little bit of schnapps.
Yeah. Well, that may not help the cough, but you won't be aware of it.
There you go. And you'd have a lot of schnapps.
Yeah.
Always rock somebody to bed with a rock.
Any other questions? I know that there were some really good questions today. What do you say with all of I don't think this is in your field necessarily, but I know many people that, are worried about the Bluetooth waves and things like that to their head as all these new devices that are out there. What's your thought on this? I'm wearing an Apple EarPod. Is that something that you think people should stay away from and stick to the old-fashioned style headset, or?
I don't know. I'm not particularly impressed with the studies, that have indicated that may be a possibility. And I don't think anybody really, knows for sure. I doubt on a intellectual basis that really that's the case.
I get it. All right. So we'll keep doing it until the aliens come.
Right, exactly.
All right. Any other last questions? I see that in the chat, someone wrote to me privately, apple vinegar helps with reflux. I'm not sure if that was a question or a
Go ahead, Nando.
comment.
I have a question. I'm Ellen Tuckman's husband.
Yeah, 1 second, David. I want to just make sure the
Okay.
apple vinegar part was addressed. Was that a question or not? But I don't know. Does it help?
Yeah. I don't know. I think that I've heard someplace where that might be the case,
Okay,
but there's other,
of
medications
course.
that can be used for that.
Okay, thank you. All right, go for it, David.
All right, I'm a retired dermatologist, and one of my patients years ago, must be at least 20 years ago, had a problem unrelated to my field, but to ENT. She had a condition called spastic dysphonia, and she was treated periodically by an ENT specialist with intralesional botulinum toxin.
Right.
And it made a difference right away. You could see it. Almost immediate relief where you could hardly understand her. And then when she got this, it was very easy to understand. Just an observation. Is that treatment still used?
Yes, definitely. Still works very effectively.
Yeah.
Wow.
The Botox, is that the same bacteria?
Yes, that's
Yeah.
Botox. Yes.
Right.
Oh, David, you're trying to make us all look like we don't know doctor language. You could have just shared Botox.
Oh, I'm sorry.
just-
Sorry.
I'm joking with you.
Sorry. Sorry.
But it's interesting how I always think, some of the, I guess, methods of attempting to correct things are still, we don't use the newest methods necessarily. We use something that's as old as 20 years ago. And that's still just correct.
Right. Well, essentially the things that work last the longest, right?
Right.
So that if something, it's sort of like music. If you listen, I like classical music, and to me, the music that has lasted for 300 years or 200 years has something to be said when compared to the music that lasts 6 weeks.
Right. That's true.
It's also familiarity, and as music, if you know it, you enjoy it. If you don't know it, it's hard to get used to it.
That's true.
They're supposed to correct the volume on these television programs when you have advertising. So if you have a problem and you turn the volume up, the minute the commercial comes on, you have to turn the volume down. But that was supposed to be corrected by the FTC, and it never.
Well, and your television's supposed to do it
Right,
also.
the television's supposed to do it. It doesn't do it.
Now, as the presenting doctor today, is there a question that you think someone should be asking about hearing aids?
No, I think it's been pretty well covered. I think in general that don't look for the miracle. It's not going to be, and at the same time, don't dismiss a cheaper hearing aid as being as effective or almost as effective as a more expensive one. Try it out. Try any hearing aid that you buy. Try it before you make a decision.
Okay, a question that just popped into the chat, but I'm not sure if this is a correct word. Do you recommend dot shows? Or
No,
what is that, Lori?
that was me. DPT, because I heard that seniors are very, I don't think it's called DPT shots anymore. My typing is not very good. I'm sorry.
No problem. I thought maybe it's, some new treatment I don't know about.
Yeah.
DPT vaccine.
Because because of the pertussis part, and I had heard seniors are likely to get whooping cough. And I guess that would be part of ENT, I think, because of the coughing. And I didn't know about it. I know I always used to get it, and I was supposed to get one. And my family doctor said, "Why do you want that for?" And the pharmacist said you should be getting them. And I know when I was coughing a lot once, my ENT wanted me checked for
Pertussis.
what do you call it? Whooping cough, the pertussis. Yeah. So I was wondering if we should still be getting them as seniors.
I really don't know. I think that if it's recommended, it should be done. At least, if that's a recommendation from the CDC or whatever. And I think that is the case, and it should be adhere to. They know more about it than I do.
So you've
Okay, so
seen,
check-
Lori, I
Yeah,
think he's
check-
saying that he sees that the CDC does recommend it.
Oh, I'm sorry. The CDC does recommend the DPT shots for
No, I'm
seniors. I
not,
think,
I'm not, I would check to make sure what is recommended, and I would go by their recommendations.
okay, and check with my ENT and ask him then or
Right, you could
something.
probably
Well,
just-
yeah, I don't know who to ask because I've gotten so many different opinions on
Right.
it for seniors, so.
Well, I'll tell
Okay,
you
so-
what it says on Google, and this is from Consumer Reports Vaccines for Seniors. It says Tdap vaccine. Who needs it and when? Older adults need a single dose of Tdap for protection against pertussis if they've never had one before. This has been recommended for all adults since 2005, but only about 20% of older adults have ever received it, according to the CDC. So if we trust Dr. Google to bring us correct information, they're saying that yes, you should do it. One shot.
Oh, if you have never had one before, because I
Correct.
used to get them every 10 years, so I used to get them every 10 years, and I realized 10 years is just about up, and I didn't know what the story was. All right, thank you both so much. I appreciate it.
But definitely ask your doctor anyways to confirm that maybe you need one after a certain age, because this is saying after 64 as well. I don't know exactly. I just share what I read, and I will tell you that the doctor said ask the doctor.
Right, pertussis is becoming rarer as time goes on, and maybe one of those problems that we may not have to worry about sometime in the future. But for now, I think it's very good advice to just find out what's recommended and go by that.
Last
Thank
question for you, and then if anyone has a last question, we'll take it. But if not, I don't want to take more of your time. As people age, other than hearing, what is the most common reason to visit the ENT?
Well, it depends upon what their problem might be. I guess hearing loss is probably well, hearing problems or ear problems is probably the most common problem that's seen by ear, nose, and throat. And the second probably would be sinuses.
Oh, makes sense. And just on noticing that as a consultant now with issues that people have at work sites, from the police department, I know a lot of officers have issues hearing from their radios. That's their workplace issue for hearing. I don't know if you see that, but I've noticed that.
I see that complaint fairly frequently.
Now, and I assume it's true.
It depends.
Got you.
Yeah.
Love it. All right. Dr. David Tuckman, who earlier asked you the question about the famous wording for Botox.
Actually, it's Ellen.
Oh, Ellen, you went to Temple? Oh, okay.
Yeah.
All right. Well,
Oh,
I
very
think they're
good.
trying to figure out if you were in school at the same time. But either way, before we go to chit chat, I do want to thank you very much. This was very informative. And I know that in addition to all the good you do in the community, we appreciate everything that you've shared today. So thank you very much.
Sure. Thank you very much. It was very nice to do this.
Thank you.